Hello, my dog lovers. I am so excited today because I have one of my favorite vets and colleagues, Dr. Lynda Loudon here. And we first met in Orlando, Florida, at Dr. Judy Morgan's conference, and we kind of hit it on, and we just really like talking about things. And so we thought, why don't we just get together for a little more longer conversation? Hi, Linda.
Hello. I'm so happy to be here. Thank
I'm
you.
so happy to be here too. And I'm so glad that we actually sorted all the challenges with our sound. Both of us
Yes.
had challenges with sound. I think it's
Yeah.
Mercury in retrograde or something, but we are here.
Yes.
And I can't wait to learn more about you, your life, your practice. And maybe I'll just pass the talking stick over to you and let you introduce yourself and just kind of share with our community who you are.
Great. Thank you. Well, I am Dr. Lynda Loudon. Like you said, I've been an ER vet for over 24 years. I grew up knowing I wanted to be a vet and that I was a healer. And I've just had the beautiful opportunity to do what I love for a career. So I've was in the ER for 24 years. I have stepped back this year to start an online business to reach more guardians, dog guardians. But I also have a home euthanasia business as well that I've had all of these years because I always was passionate about being the vet who was there when the animals needed me most, when they were on the brink, and I wanted to bring them back. And then I also was really passionate about being the vet who, if I couldn't save them, that I could give them the most peaceful transition and support the guardians in that space. So yeah, that's what I've done for the last 24 years, and it's been just a beautiful journey.
I know that working as an emergency vet is not easy. Doing euthanasia is a combination of witnessing the most intense love and the most intense grief at the same time. And so we're going to touch everything today. But before we do, I'd like you to take us back to your childhood
Yeah.
and maybe share with us what you were like and what were the early experiences and influences that kind of made you go the direction you have. And yeah, I'm curious.
Yeah, I'd love to. Yeah, I don't share this much, so I'd love to share this. I grew up with a mom who was a beautiful soul who just had the connection to animals that she passed on to me, and I learned that from her. She had a deep love for dogs, especially, and so she gave me that gift. But she also had a really hard life and had dealt with depression and couldn't really be there for me as much as I know she would have wanted to be, right? Couldn't show up as the mom that you all want, right, growing up. And she had good reasons for it. So I was alone a lot. And I would try to get away from my house. There was, some chaos going on sometimes. My brother was in an accident when he was in his 20s. He's much older and was paralyzed. So there was a lot going on in my house. And dogs were my reprieve. They were my comfort. They were my steadfast friends that I would take off. We lived in Connecticut on acres and acres of land, and I would just walk with my dogs, my pack of dogs. We bred Shelties, and I showed Shelties growing up. I was a dog handler growing up, showed at Westminster every year and everything. So that was like the beautiful things I shared with my mom. We were on the road on weekends going to dog shows and sharing that beautiful hobby together. But then at home, they were my escape. They were my peace. And it ended up one of those things that I do believe happened for me. It wasn't happening to me, that in order for me to be the healer that I ultimately became and the intuitive portion that I bring to it, I needed that to happen the way it did. And then I also wanted to show my mom, okay, like I have the same love you do. Look at me. Like, what could I possibly do? And this wasn't conscious. I realized this as an adult that I was like, well, what could I possibly do to make her proud and be a vet, right? That was the highest thing I could think of in the animal space. And
Mhm.
another thing that happened for me that led me to the path of my career. So that's me. And I was that little girl healing birds in my hand and doing energy work long before I ever knew what that was. And for a long time, dogs were easier for me to connect with than people.
Yeah, I can understand. And, just kind of hearing what you've experienced as a child. I have this idea or philosophy that early hardships actually often lead to greater human beings and accomplishments, or people just kind of need the seasoning of life to be who they become. I think that people who have really easy early childhood and life often just kind of grow up thinking that life will be like that, and it's not. So, I can definitely share those experiences with you, even though my childhood was obviously different. I grew up in Eastern Europe, and it was on some level harmonious, and the other level it wasn't. But I can empathize, and I also can see how it was difficult for your mother to actually deal with your brother who was paralyzed and then needing to look after you. So dogs, they're just amazing. They always step in when the humans are not able to provide what we need, right? Isn't that true?
It's so true. It's so true. I feel there are guardians sometimes more than we're their guardians.
Is there something about your journey that people would not expect or you get even rarely asked about? Like, is there something that you feel like, oh, I really would like to kind of share this with people so they understand me better? At the same time, I was never asked that question.
I think one thing that I went through becoming an ER vet was that I was very intuitive before I went to vet school. And then I forgot about my energy healing and that intuitiveness because I came out of vet school. You go to vet school, as you know, right? And you're in the books, your head's in the books. That's all you're doing. And then you come out and that's all the way you're thinking. And I just wanted to be the best critical care doctor I could be. And so it was all up here. And for the first few years when I was out, I forgot that there were other modalities. There were other ways that I could help my patients. And it didn't always have to be me figuring it out up here. And, there was one cat that I remember, he was in the ER with me all weekend. He had an owner who could not lose him right now. She really emotionally, mentally needed this cat to survive. He was only 5 and he was in renal failure. We couldn't figure out why. Didn't make sense. Couldn't find a toxin. And I spent all weekend trying to save this cat for her. Pulled out all the stops. And I had to call her that Sunday night and say, if I can't turn him around, if nothing improves by tomorrow, we're going to have to make a decision because it wasn't fair. And so that was it. And that night, I'm sitting there thinking, what else could I possibly pull out? What could I do? And I took the cat out of the cage and I went in the bathroom and I sat with him on my lap. And I just focused on his kidneys and energy like I had as a little girl on the little birds that I was trying to help. And of course, I'm embarrassed. I wouldn't ever tell anyone. I didn't tell anyone for years that I did this, right? I didn't tell my husband, who's a vet, till like 5 years ago, right? So I took him, I put him back in his cage, and I went home. And I called in the morning to talk to the ER vet in the morning. I said, what are his values? She's like, Lynda, you're not going to believe this. They're normal. Now, they weren't even registering. They were so high. Wow. And so that's when I woke up again and said, oh, there's so much more that I need to be bringing to my patients, and it also pushed me even further down the holistic path to bring in other remedies and work on the whole patient rather than just only thinking of more treatments and diagnostics for my brain,
This is an amazing story, and I can relay. Sometimes things happen that are totally unexplainable. And if you even ask someone else to repeat what you've done, they won't be able to, or it won't work.
Right.
And I had a long time ago in the early 2000s, I had about 15 cats in a little study that I did treating hyperthyroidism. And about 7 or 8 cats, the study's published, it was actually presented at WSAVA. And 7 or 8 out of the 15 cats recovered from hyperthyroidism long term just by giving homeopathic remedy from table salt. And me as a person who was taught this for that and definitely not table salt for hyperthyroidism was a little stunned by the whole results. One of them was my cat that was diagnosed at the age of 7 no radioactive treatment, no tapazole or methimazole, and she lived until 21. And she had normal levels with a little few spikes before repeating the treatment. But then I shared this with my colleagues, and they tried the same method, and it did not work for them. So I kind of stepped back from homeopathy since then, because it is kind of hard to understand. And it's just like energy healing and intention and all that. It's definitely there, but we need so much knowledge and learning. And the approach that we learned at vet school, this for that, or this is the disease and this is what you're going to do. And it's like reading notes or music of someone else. But when you really become a veterinarian who you are, I believe, and I'm seeing that, it's almost like you're kind of like playing music out of your heart, or you have a feeling for what it sounds and when it sounds right and when it doesn't, right?
Oh, that's a beautiful way to express it. Yeah, that is exactly how it feels. Yeah.
It's like it feels, right? Like right decision feels a certain way. There's a light or breeze or something about it that feels right. And we're willing to go beyond that and just kind of maybe risk the preconceived ideas, what we should do, and maybe even risk our reputation if things didn't work out. But weirdly enough, they almost always do better than when you follow the protocols, right? So that wasn't the only instance where you kind of thought, okay, I need to go more holistic or integrative in the emergency care, because, emergency medicine to me, as a traditionally educated, conventional vet, was always the pinnacle of knowledge, right? Like you deal with really serious emergencies and life-threatening conditions. How did you see it yourself? Like when you were in it, was it like, did you feel like it was more demanding than solving chronic disease?
No, I think we're all made for different things, right? And so that it felt easy for me. And that's how I knew that it was for me. My husband, who we met in vet school, he's a general practitioner and he is in his element. And I would call him and be like, I went into general practice for a year and it was not my place. And I was like, I'd be calling him, Tim, what do I give for this? Like, preventative care was not my thing, but it was easy for him. The ER was easy for me. I never felt, it was my calm. I never felt stressed or worried. I need things changing, or else I get bored.
A little bit of adrenaline rush as well.
Yeah, I love it. I love it.
See, this is the funny part that, I just like that consistent flow as opposed to the ups and downs of the emergency. But it's so interesting. So how did your perception of emergency care and maybe drug use and the conventional medicine use changed over time, knowing what you know and also having the experience of being in both worlds? Like, how do you see medication? How do you see drugs? Like, are there some that you really appreciate and value, and others that you kind of feel you would prefer if they disappeared from the world that we live in?
Yeah. I mean, I see a lot of just overused, right? There's drugs that I need in the ER, like lidocaine. If I need to treat an arrhythmia, I need lidocaine. I need a lidocaine drip. If I have a cat that has no blood pressure, I need a norepinephrine CRI, right? I need those. If I'm doing CPR, I need those drugs to help me with my CPR. I'm going to put my energy work into that. And there has been CPRs, like I was known as the CPR person, right? Because there was more to my CPR, but I needed those drugs to get a lot of those animals back. So I valued them very much and appreciated them and used them where I needed them. But I also, on one hand, in the ER, saw colleagues like overusing things or even ignoring, not really digging into that patient and connecting with that patient and what is going on with that patient, just saying, okay, that's a vomiting diarrhea. That's going to get Pepsid, Cerenia, fluids onto the next. Well, no, not every dog needs all of those. And some absolutely don't need that, right? Metronidazole for every diarrhea case that came in.
Absolutely.
Not thinking about, on the other end of that, what are we doing to the microbiome? And what is actually the primary cause? Instead of just covering up that symptom.
and the intestinal lining gets damaged. And there's so much evidence now that metronidazole actually damages the intestinal lining for many months, if not long term, right?
And I've seen puppies, right? Have you seen puppies where I don't think that gut ever comes back when they're
Yeah.
just
Yes. Yeah.
over medicated at the beginning. But I also, over the years, saw trends that became very clear to me. You know, I dealt with all the immune mediated diseases, right? They'd be getting the vaccines in the vet, and then they'd be coming over to me in the ER with no platelets or hemolytic anemia, where
Yes.
I see, yes, that was the trigger. And I'd call the vets and they'd be like, no, I don't think that's what it is. No, it's very obviously what it is. It's a little white dog and you gave it vaccines 3 weeks ago and it's 12 years old and it didn't need any of those. And I started to get really annoyed and angry about it. Clearer it became to me, you know, like these seizure dogs coming in and they're on all of these toxins. And the vet just placed a flea and tick med recently, but they won't connect it. But it was very clear. And I understand it because you're in it, right? So I had that different perspective of, okay, now they're coming to me in the ER and I could see that more clearly. But became very frustrating for me.
So you're seeing the patterns that I have seen as well. Do you think that sometimes, you know, when we are in veterinary practice, we are supposed to help, and just the burden and the weight of the fact that we're causing harm actually prevents us from, or prevents the community, veterinary community, seeing what is actually happening? Like, is it possible that people just can't really even bear the burden? Because I believe that most vets are well-intentioned and that they do things that they
100%.
believe in.
Yes.
So why is it so difficult for some of us to see what is going on? Do you have any explanation? Have you had any conversations with veterinarians have you tried to convince someone, hey, you know?
I have. I had this conversation with an elderly vet, had been doing it longer than I, probably 50 years. And like he's passionate and he's well-intentioned and he's dedicated his life to his patients. And so a cat came to me from him that the woman it was a 15-year-old cat. She was like, it was just me and him. I just wanted to make sure I was doing everything possible. He hadn't been to the vet since he was a kitten, took him in and said, just do everything that you need to do to keep him healthy. And he gave him 4 vaccines, this 15-year-old cat who had symptoms of hyperthyroidism. He was living his best life, maybe drinking a little bit more, eating a little bit more, but he was living his best life. And within hours, he was in my ER and I was trying to save his life. And I couldn't all weekend trying to save him. And I called that vet and I said, obviously, this is what happened. And in a very nice way. And he was so upset about it. The owner had already called and, given him an earful, and he was really upset. But he still really believed in his medicine. He believed that's what I was taught those years ago. And if I don't do that, I'm risking that patient. He truly in his heart believed that is what he had to do in order to protect his patients. And I believe that's what he felt. By the end of the conversation, we spoke, he said, oh, I will change some things. I will get the blood results back before I give any vaccines. And I'll consider stopping vaccines sooner. This cat was 15 years old. So he did see my point, but he had a conviction that was how he was protecting his patients. And I believed him. I think there's also that what you said is you don't want to feel like you have hurt patients or that what you learned is not true, right? Because vets, I think part of the problem is we get Dr. Googled all the time. And you have clients coming in, well, I just spent 9 years becoming a vet, but you're going to come in with your 10-minute Google search and tell me what you think, which is different than the client who's just trying to explain their connection to their dog, right? And
It's
so
complicated.
maybe we have that barrier up where we're like, no, what I'm doing is in the best interests of my patients. And it's harder to break down that barrier. We've been conditioned to stand by our conviction.
Yeah, I think that there are so many aspects of this. There is the fear of not knowing, which I think is deeply embedded in our community. mainly because we were taught that if we are at school and if we don't know, we fail. So that's one part. As you were saying, and we were kind of like touching, most vets are well-intentioned, but I also think that it's like a combination of fear and a little bit of an ego, right? Like I sometimes feel maybe we should just cancel the titles, the doctor title, and just be Peter Tobias and Lynda Loudon as opposed to, all of us. Because I think that the doctor is, obviously we studied hard and maybe that's a little bonus for having the doctor in front of the name. But what does it really mean? Like, does it mean that we are better or worse? And I've learned the most often or the most from my patients and my clients because they're open-minded and they don't have preconceived ideas. And I wanted to touch the issue of vaccination and immunity because I so agree with you that we have been over-vaccinating our patients for decades now. And it's really sad. We still have to have these discussions because when we go back to the classes of immunology, we know that the immune system actually maintains memory and kind of can produce antibodies for a lifetime often. And we also know that in the real world, in nature, there's usually one pathogen kind of attacking, in quotation marks, the body at one time, and there's not like 6 or 7. And we have gotten used to the practice of giving 24, 25, 30 antigens within the first few months of a puppy's or kitten's life. How can we expect that the immune system will not turn onto its own body and will not start attacking platelets and red blood cells when we're just stressing it up to the max? Like, it's almost like, if someone throws like 5 different tasks on our desk and said, do them at the same time. So I'm glad that you're touching it and touching this topic. And do you vaccinate at all now? Or I can share my approach, but I would like to first see what you do and compare notes.
When someone asks me my opinion, and I've titered puppies after it, they've titered after 1 and definitely titered after 2. I've never had a puppy that needed 3 rounds of vaccines ever.
Yeah, I agree with that. And, with my dogs, with Sky and Pax, because I travel, I had to give them rabies, but that's the only vaccine that they've ever gotten. And weirdly enough, or maybe not as weirdly enough, they actually have maintained parvovirus and distemper antibodies for their lifetime. And what I usually do, I take a titer test at 12 weeks. I make sure that nobody gives any vaccines before 12 weeks. And then at 12 weeks, we kind of take titers and see if they're positive or not. And if there's even slight positive response or antibody response, then we actually just take another titer in a month or at 5 months and then 1 year. And most of these dogs actually maintain antibodies because they were originally protected with maternal antibodies, right? And then they kind of build their own without ever having a lapse in protection. And weirdly enough, some immunologists now say that if we give vaccines before the body can produce their own, it's counterproductive because the vaccine neutralizes the antibodies, right? It's antigen-antibody reaction. So we actually are theoretically and maybe practically leaving the animals unprotected if we vaccinate them early when the immune system is not mature enough to produce their own antibodies. So it's mind-blowing.
And those puppies that I've seen in the ER, where, they've come from breeders that have started vaccines at 6 weeks, and they've been vaccinated every 3 weeks, 3 or 4 times, dewormed 6 times. And I see those puppies in the ER with aplastic anemia. Their bone marrow is wiped out. I can't save those. And the ones I have saved have not lived for very long because their bodies just can't handle it. It's so sad.
I have a question about gastric dilation volvulus, bloat, and stomach torsion. Mainly because I've observed in my practice that the animals who suffer from this condition or end up bloating have unusual sensitivity or even an injury or even spondylosis or arthritic changes around the thoracic lumbar junction, which in Chinese medicine is connected to the stomach and pancreas. When I talked to some of the emergency veterinarians, they told me that they actually have seen frequent spondylotic or arthritic changes in those segments when these animals get bloated. So I came to kind of conclusion, and I'm not really sure whether I'm 100% correct, but I've seen that the muscle spasm and tightness and lack of energy flow in that particular area can actually increase the chances of bloating. Have you seen any connection
No.
like that? Or
Honestly, I never noticed that connection, but that's amazing. Yeah.
I don't really know whether, obviously, it's probably not the only factor, but I think the spine is actually very much the energy highway for the body, and it supplies all the organs and parts of the body. So it's an interesting thing.
Yeah, I mean, the one thing I would say, I've done hundreds of bloat surgery. That's probably one of our most common surgeries in the
Hmm.
ER.
Hmm.
And I've never cut a dog that was raw fed. And I know that I've had associates who have, but I
Hmm.
personally, over the hundreds that I've cut, they were all on kibble.
And I'm so glad that you're actually saying that. I'm obviously really sad that he had to do operations like that often, obviously.
Yeah.
But I do have a feeling that there is there's two components. I think that when we feed kibble, the muscle layer of the stomach gets weaker because kibble don't need much grinding and the stomach strength, as opposed to raw food and bones, right? So, and plus the fermentation of kibble is also another element. So thank you for confirming that. And I know that those people who have large breed dogs, especially deep-chested dogs, they probably will like to hear that when they feed raw food, clearly they're going to be reducing the chances of
Absolutely.
gastric dilation and volvulus. So that's really amazing. I know that you've been very active with your community and you've created a charity and you also have online professional community and dog lover community. Can you tell me a little bit more about that? Because it seems like you're doing so many things. I don't really know where you
I
find
know.
time for
I know.
that.
It's a lot of things. We all do, right? We all have so many passions. I'm like, oh, I want to help these people. I want to help this way. But so my main thing is that I left the ER because I wanted to get in front of guardians before they were needing the ER, right? Because my associates weren't ready to listen to me. So I was like, I've got to get to the guardians. And I was very frustrated. And it was after that cat that I spoke about that I was like, that's it. I've got to do something. And so I started an online membership called the Dog Mom Society, where I can guide guardians through making the right choices with nutrition, with preventative care, and just be there for them to support them. And it's growing. I've got other professionals and experts in there now helping me, nutritionists. We're going to start an emergency hotline within it because I find a lot of the ways I'm helping the clients is they're calling me from the ER. I'm in the ER. I need you to walk me through it. That's where I've been able to help them the most. So that's my Dog Mom Society, where it's just those guardians who want to make the right decision. They want to learn, get that knowledge in order to do that. And then when I came out of the ER and started building this online business, I was like, I'm an ER vet, I'm a surgeon, I can figure out anything. And the technology around, we were just talking about it right before we came on. I was like, I can't figure this stuff out. This is so hard. And it took me a long time to learn how to build an online business. But when I took all these courses and everything, when I finally figured it out, I couldn't stop talking about it and teaching other people. And so that's another way that I can help my mission. That's the same as yours, right? Is to bring the holistic medicine and the changes in the standards of care for our dogs is by teaching online business to other holistic practitioners so that their voices can be heard. So I have the Canine Experts Academy and I teach online business in there. And then I have a Healing Haven Animal Foundation is my nonprofit. And we pay for, as an ER vet, I will never not treat a patient because they can't afford it. If I know how to if I can save their life, I'm going to save it. But that gets expensive and it's hard to do. And logistically, you can't keep doing it. So I created my nonprofit to pay for life-saving care in the ER for those patients whose owners would have to euthanize them because of money. Or if they don't have an advocate, they're a stray off the street and they need a surgery. And so that's why I created Healing Haven.
You've got a big heart and you obviously know how to manage time because, when it comes to helping dog lovers and then helping colleagues and then on top of that, helping dogs and dog lovers who can't afford the care, it's really amazing. And I think that there always has to be, they say that the happiest people are the ones who actually really give out without really expecting anything in return. And I can definitely, when I look back, like the situations and the moments that stuck in my mind are the ones where I was able to be there for someone without really expecting anything in return. What would you recommend to people who want to obviously prevent emergencies? If there are like 5 things that you would say, do or don't do to avoid emergencies, what is it?
I would say get the nutrition right. Work on your dog's nutrition and their gut biome, because their gut microbiome is their immune system, 70-80% of their immune system. So if you're working on what you're giving them, and then on the other end, making sure that microbiome is where it needs to be, that is, you're 90% there. Your dog's going to be healthier than most dogs, and it's going to prevent a lot of the things that come up. A lot of dogs will be like, oh, my dog's sensitive. He can't eat anything other than kibble. Well, that's just because his microbiome is so messed up, right? You're not going to have dogs that are just going to vomit and have diarrhea from trying anything different, because their microbiome is so diverse and healthy. And so you're going to have less trips to the ER with those gastrointestinal symptoms if you have that right. And then just listening to your gut, right? Because guardians know their dogs better than any vet ever will. And if your dog is off, if something's not right, if something you're doing is not sitting with your dog, listen to that intuition, because it's real. And, work on that bond with your dog, because then you can truly be their advocate and speak up for them. And when you get into the ER, yes, speak from mutual respect, right? We respect each other. We're going to get a lot further. But don't be afraid to advocate for your pets.
Be there for your dog based on your knowledge and the information that you've already gathered. My world was kind of shaken a couple of years ago when my wonderful, beautiful, healthy 2-year-old border collie was neutered. And I'm a sleepwalker, and I have each dog actually is trained for my sleepwalking and being able to stop me from sleepwalking. I sleepwalked through glass door when I was in my 20s and almost died. So I was in an ER as well at that time. But why I'm saying that is, so he was neutered and we tried to delay it. And within about 4 or 6 months, he started limping, and he started having basically just unrepairable injuries, and not necessarily that he would tear cruciate ligament or anything like that, but he was just limping and he was not recovering. And so I tried everything. And at the end, I ran across studies of Dr. Michelle Kutzler, who has researched extensively the inflammatory processes in neutered and spayed dogs. And she derived the studies from women in menopause who have actually experienced the same symptoms, injuries and painful areas and so on. And so she discovered that the luteinizing hormone that elevates about 3 times when animals are neutered, the hormone that stimulates testosterone production, estrogen production, as you know, can actually create inflammatory responses and reactions in all sorts of different tissues by latching onto the receptors elsewhere, because the testicles and ovaries are missing. And she discovered that it leads to hypothyroidism, muscle injuries, ligament tears, organ disease, change in the brain function and all that. So I actually used to think that inflammation or allergies and all sorts of different chronic conditions can be addressed by, let's nourish the animal well. Let's give them the nutrients that are missing in the food, like minerals and good vitamins and omegas and probiotics, and maybe align the spine and everything will be fine. Well, I witnessed the reality of that not being enough. So I actually put my dog on hormone replacement therapy based on the studies, and also on the, thanks to the support of Michelle Kutzler and some other colleagues. And my dog has recovered within 4 months. He's now 1.5 years post start of the treatment, and he's a picture of health. And the reason why I'm saying that is that such a humbling situation, because I thought that I could figure it out. And I had a really important piece of the puzzle missing. And now I feel like, oh my goodness, like all these inflammatory and chronic conditions, they may be related to this issue, especially now seeing several patients like going through the same transformation. So I'm wondering how many dogs and cats would not end up in emergency care if their body actually metabolically functions the same way as if they were intact. And so there are now hormone sparing sterilization, the WSAVA. I'm not sure whether you know, they started promoting hormone sparing space and neuters. But once again, you were saying how long it takes for people to change. And I'm seeing the same thing. I have dog lovers who are accusing us of, promoting homelessness, and they don't understand that there is another way. And also other people are and colleagues are super afraid of doing something that is just so clearly positive, and the research is coming up more and more. So what do you think of all this? Because I love to get your reflection of what you've seen in practice and your opinion, basically.
Yeah, the cruciate tears alone, right? That makes so much sense because that is one of the most common emergencies I see is a dog coming in limping, and it's, 9 times out of 10, it's a cruciate tear. And you're like, we're obviously doing something wrong. There's not wolves out there with cruciate tears, right? What are we doing to these dogs? Mm-hmm. What decisions are we making that are leading to this? And so when studies came out about the early spay neuter, it just made so much sense. And we just have to change the way we're thinking about things because it's really common sense, isn't it? If we look at it, you're taking away all of these hormones when they're in their growth phase. And even though your dog was 2 years old, there's still hormones that their body needs at a certain level. And we're just like, oh, we're just going to get rid of those and expect nothing to happen that's negative. So it does make so much sense. And with the dogs that, okay, I've got neutered and now 2 years later, they're hypothyroid and obese and, their coat loses its shine. It's quite obvious if we look and see it, if we're willing to see it.
I think that what is the most striking that we have kind of unknowingly ignored the metabolic importance of hormones, and that we've taken these dogs females through early menopause, basically puppies at the age of 8. We don't even let them develop, right? And now I'm realizing that even if we let them grow, that they lose muscle mass, they lose the metabolic kind of intensity and quality that they need to be healthy. So I recognize spayed and neutered dogs from intact ones or from those who are vasectomized because they have this different, like the intact dogs. And in Europe, when I'm in Prague, and I spend a lot of time there now, they have just a different spring in their gait. Like their coat is better. My dog actually used to mat in his groin. Like he used to have mats that I would have to cut out every week. And he has 0 mats. Like his coat is beautiful and long. And, he used to react to chicken. He doesn't. It's just like, there's like so many different things. But I think that we have to give it some time and be kind of like understanding again that we all are trying to do our best. And sometimes it's frightening to go through change. But I also know that it's frightening to see our animal friends aging. And that brings us to the euthanasia topic. And kudos to you and hat down for you actually choosing to be a euthanasia vet. Because I must confess that every time I euthanized a patient, it felt like a piece of me went with them. And so how do you see that? How are you able to be there for your clients and patients? And what do you do actually to make it easier?
I am energetically, and it's hard for me to explain, like we were talking about before, when you're trying to explain to somebody like what you do, but I connect with my patients, especially when it's around euthanasia. And so I feel, and because I've been doing this 24 years, this has been a major part of my practice, right? So when you're doing something and you're in it and you're growing in it, I can feel these animals that they're ready and they're okay. And that gives me so much comfort. For me, the hardest part is the guardians suffering, that they're suffering. But for me, going into a house, most of the dogs know I'm coming. They meet me at the door. I'll have dogs that have not walked in a week, and they walk to the door, and the guardians are like, and I warned them that might happen, and they're like, I can't even believe this just happened. Sometimes it can be confusing because they're like, oh, he's better. I'm like, no, he's not. So I feel that from the dogs. I don't feel the suffering. I don't feel fear. I feel like, thank you, I'm ready to go. And they know they're not ending. And that's what I get from them. And, I leave there and I'm talking to them and I feel them. So for me, it's not like I'm taking this life away. I never feel that. And when I go into these rooms of people, families, I get goosebumps talking about it.
I know.
Like you said, it's such a beautiful, sacred space of love.
Mm-hmm.
The love that's poured in, the memories, you can just see them of the memories of teenagers now that have grown up with this dog and how beautiful this dog has walked this journey with them. And I get to witness it and feel it every day, multiple times a day. And so for me, it gives to me. It doesn't take from me. I leave there feeling like, yes, I feel compassion for the guardians so much because I know what that feels like. And I feel their suffering, but I feel the love so much more and the experience of it.
I must agree that it is quite an experience to actually be and have the privilege to actually say goodbye to our patients and be there for them. I've had situations where we would actually, and most of the euthanasia, so I try to do at home. If I could do a house call, I would, because I know that the animals feel better. And sometimes people would prepare little gathering, or they would open a bottle of wine and they would share pictures and we would cry and laugh. And it's an interesting opportunity for us to witness that dying is actually not as terrifying as we think it is. And we live our life being terrified of dying, but when you witness it over and over in this beautiful form, it's a little relief, I think, for at least I'm not afraid of dying. I think that the worst case scenario is that when people don't have the quality of life, and animals don't have the quality of life for years, and they kind of suffer and they survive but don't thrive. I think that for me, that's something that we need to prevent. And I would prefer the curve of life being like this and then drop down, as opposed to it being roller coaster and slight decline and not really good quality of life. And I know that's why we are here, and that's why we teach people to make sure that they feed their animals well and that they give the right supplements and provide all the nutrients. I have to share something. I've been always a little perplexed. Like you may know that I formulate formulas and products, and it took me a while to actually start seeing the differences. And I clearly, like, just to kind of see, oh my goodness, like now I have 10, 15 years of data and I can see how much difference it makes. And what blows me away, that there are still some people who think, oh, I can give my dog just kibble or just food and nothing else. Like, they don't realize that food is depleted and that is grown on depleted soils. And at the same time, they would go to their garden and look at their tomatoes and say, I need to put some organic fertilizers on the tomatoes because, they look a little weaker and so on. And we somehow think that our bodies and our dogs' bodies are this perpetual mobiles that actually don't need the building blocks and that they can function without them, while our soils are 90% depleted from what they were 100 years ago. So is there anything that you wanted to add? I've gone on a little bit of a rant about it, but it just blows me away that we sometimes don't see the things that are so clearly, that make sense, right?
Yeah, no, I get it. And that was where I kind of woke up more to the nutrition piece, was when I had my first son, who is 15 now, and I was making all of his foods. I wouldn't buy anything from the store. Everything was organic. And I was still recommending kibble to my patients, prescription diets. Mm-hmm. And I'm like, what am I doing? I would never take a cereal, a processed cereal, and feed it to my child. If my pediatrician said, the only way he's going to be healthy is if you feed him this every single meal for the rest of his life, I would get a new pediatrician. I'd be like, no way. But yet I was accepting that for my patients and for my own dogs. And it's common sense, but we were so conditioned, how we got here with big companies and companies telling us, the vets, of what nutrition is and us not really getting that in vet school. And to be honest, when I was in the ER, now I'm going a little off a tangent though, we're seeing patients every 15 minutes. I've got an ER filled, right? And I'm just trying to save lives. And then someone asks me about nutrition, and I'm like, I can just point to a bag that says kidney on it and go on to my next patient.
Yeah.
For the first couple of years, I did that, right? But every time I did it, it didn't feel right, right? And I had to listen to that intuition. And I know every vet has it, but we kind of push through it because we don't take the time to stop and change our thoughts and our knowledge and learn what's not fitting. And I think that's one thing that, I wish we were talking in vet school, that intuition, that healer in all of us. Mm-hmm. If we're just pointing to a bag because we don't have time to learn about it, our bodies are going to tell us that's not the right answer. And we've got to listen to it. And instead of, okay, if you're not going to listen to us who have changed, listen to your inner self, your own intuition, and let it guide you to the healer that you may have forgotten, because I know that I did for a while when I first started out.
Well, I was in the early 90s, I was one of the top selling processed food person in British Columbia when I practiced. So.
Yeah. And all with good intentions. All with good intentions.
All with good intentions, right? Like I tried to discourage people from the junky brands. That's what I thought, but I didn't realize they were all junky. The kidney diet myth. It's a good example of what you're saying, because when I started practicing, obviously, low protein diets were part of kidney disease treatment. And I would see all these dogs and cats coming back in 3-6 months, just completely emaciated. And we were taught that it would be just the kidney disease, and that's why they lose weight and muscle and so on. And so metabolically, we depleted them and just kind of damaged them even more by not providing them the basic protein. And so at a certain point, I started actually offering and suggesting high quality protein diet for those who are like early or, not late stage of kidney disease, but pretty much all the others. And they were doing so amazing for years, and they would not lose muscle and they would do really well. And I would go like, whoa, wait a minute. Like, we're depleting these animals of basic nutrients and we think that they can do better on this low protein diet. But then, like, don't they see it? Those people who formulate these diets and who still defend these crazy myths, and how can they live with the idea? Or they probably know and understand it, but how can they live with that idea that they're doing something that is not optimal? Like, I think that many of them know. Some of them may still not know, but that's why we need to be there for dog lovers and pet lovers in general, to humbly say, hey, we may not know everything, but we can give you guidance that will definitely decrease the chances of your beloved creatures getting sick. I still would like to stay with the euthanasia a little bit, because sometimes people come to me and say, when do I know that it's the right time to let go? And I have an answer, but I'd like to ask you for an answer first before I share it with you.
Yeah. I, again, go to their own intuition and connection with their own pet. And it's something that I see very commonly, and I have to talk guardians through it, is holding on too tightly. And the animals absolutely need you to let go. Not just say it, not just say you can go, but actually sit with them and connect with them, just the two of you, and allow them and feel the peace of them transcending and truly giving them permission and letting them know that you're okay. I see it a lot in pets where it's just the two of them, right? And that pet is worried about leaving that guardian. And I'll give a sedative and I'll know it's not going to work. And I give xylazine, where we use in zoo animals, right? And I use that for these large dogs that would knock out a horse. But if that guardian hasn't given permission, it doesn't work. It doesn't make sense that it doesn't work, but it doesn't work. And I know it, and I can feel it when it's not going to work, and I have to tell them. And there's been guardians where I've had to work with them for 24 hours to get there before the euthanasia in order for those dogs to go peacefully, or cats. So when a guardian tells me, how do I know? It's not, there's a lot of symptoms, right? The not eating, the not doing the things that they used to do, any suffering, difficulty breathing. But for every animal, that's different, right? A dog not eating for this dog might not be the end for another dog. It has to be that individual pet, and their life force starts to dim and it starts to go. You see those changes. They may separate from you. They may be trying to, not get pet, not want to be as close to you because they're starting that separation. And we have to allow that instead of keep pulling them. And I need to give them more treatments. I need more meds. I should try another thing, another vet visit.
Yeah.
And there's so much responsibility, the burden of responsibility, where guardians feel like they need to have them live as many days as possible. And that's not our responsibility. Our responsibility is presence and guidance if they need it. So that's my long-winded answer.
No, it's beautiful, and I appreciate it. It's not long-winded at all. I think that, I've always had a little bit of the most difficult time I had the most difficult time in those situations where people didn't really or could not let go and would just take these animals through hyperbaric chambers and all sorts of different treatment or even chemotherapy when we knew that it was a matter of a few months or weeks. And I really tried to convince them that is about them and that they have to work through it, and we worked through it together. But letting the animals go is actually the most generous and beautiful expression of love. And I had the experience of opportunity to actually practice that when my dog Sky, I was traveling on business. I was trying to find the world's most sustainable omega-3s, and I flew to Norway. And when I arrived to Norway, my partner called me that Sky actually turned for the worst and that I have to come back. So I came back and I flew back, and I actually cried the whole trip. And I wrote Sky a letter that is still somewhere online on my website. But when I arrived home and I kind of saw him and I saw how peaceful he was, I knew that I had to basically deny what I needed, and I had to be there for him. And time flew so fast. I gave myself an hour, and then I gave myself additional half an hour. And my friend put the IV catheter in because I would probably miss every single time I tried to insert it. And then I actually did take the syringe and inject. And it's such a surreal experience to actually do that. And I think that we all, veterinarians, when we are there for our clients and patients, we really need to understand how traumatic and how deeply difficult it is. And so there is no solution to this quandary, because if animals live longer, we would be leaving them behind, which probably would be even worse than losing them. So
Yeah,
I think
I believe it's by design. I believe that, that they're here because when I look at my life and the dogs that have walked with me, every single one came in for a reason and either changed my path or made me grow in an area I needed to grow, got me away from bad people. And then they left, and the next one came in and taught me something different and guided me a different way. So I truly feel it's by design. They're here for us for a portion of our lives. And then we take what we can from them. They give everything to us, and then we get our next guide. That's just how I've experienced it in my life.
They come for the particular phase of our life, teach us a lesson. And when they know that it will be fine in that area, they just leave. And I don't think that there is a better job than actually being there for them. And thank you so much for being here with us and having such an amazing conversation. Is there anything that you'd like to say as a parting remark or note?
I would say, us being their guardians, and they're our guardians as well, is such a beautiful opportunity and a privilege. And there's we talk a lot in this space about longevity. Beautiful Isla Fishburne, who also talks about this, her and I have had these conversations, is we talk about longevity. We want them to give them what they need and do our best, but that's all we can do. We aren't supposed to have that weight of responsibility on us. Do our best and then enjoy them and be present and not feel that you have to get everything right. Just do your best. And we learn from everyone. Every single dog I've had, I've learned something that I could do better in their health for my next dog. I've never gotten it perfect, and I probably never will. But I'm not going to beat myself up about it, right? We can't. We've got to just take in what we can, do our homework, learn, be our dog's advocate, and then just enjoy them. Because when we're stressed about it, they feel it, it translates to them. That's not what they need from us.
And it decreases the quality of life together. I definitely feel that we have to drop the guilt. We can just do the best we can at the moment with the knowledge that we have. And then when we discover that maybe we were not doing something ideally in the past, we just have to see it as part of life. Like, we are here to learn and learn how to care for them better. And it's getting so much better. Like, I see it in the dog lovers around the world, how much more awareness there is. And it's just not as easy to fool us dog lovers about what dogs need and don't need, right?
Yeah, I learn from my dog moms every week. We have our weekly pack chats, and I'm always learning something from them. They know so much. They know so much than you would think, and it's beautiful. We're all learning together.
As a little caveat, and I forgot to ask you this, but I will. Why is it dog moms and why is it not dog dad?
I know. You know what? We do have some dog. We have some
the line
dads
here.
I know. No, I do. I get asked that all the time. I feel bad about it, but we have dog dads in there, and I picked dog moms is because, we also, and we're just adding it now. We address women's health, and that's just always been a passion of mine, is helping other women entrepreneurs, helping other women who are passionate about dogs, and so. In all of my courses, they attract women, and that's why it ended up being dog moms, because I really wanted to integrate the women's health as well, so that, because a lot of us, and I'm sure you could relate too, is our dogs' bowls are more nutritious than our own, or we give everything to everybody else, and we don't take care of ourselves. So I wanted to take care of dogs and the women who love them. It was what I wanted, and that's why it ended up being dog moms.
I love that, and I now understand it. Maybe it could be dog moms and friends, and but anyway.
I like that. I like that.
But we should have stopped, but we probably will be going for a few more minutes. I'm so interested in human health and how it connects to the health of our animal friends. I have had many aha moments, and one of the incredible aha moment has been how important strength and exercise and strengthening is, especially when we get over a certain age. And that actually the primary cause of death in humans is actually a fracture and fall and fracture, or one of the primary causes of death. And in animals, immobility is as well. So if there's one thing that dogs come to us to teach us, is how to be active and mobile, and that it's not just okay to go for a walk, but we also have to take the weights and strengthen our legs, and to make sure that we go uphill and don't take it easy, whether it's for ourselves or our animal friends. And that comes to, and then we could go on to osteoporosis and bone strengthening and supplementation with mineral support. And oh my goodness, we have to get together again, Lynda. I think that we need to. It would be fun actually to talk a little bit about the combined kind of like approach to health in dogs and people.
Yeah,
and
because I'm sure
like
you've
that.
seen it too, where the sickness, the chronic diseases in families are affecting the dogs, right? Where
Oh, absolutely.
you can see it. It happens. It's definitely connected. And yeah, I'd
And
love to talk
emotions
about
as well. Emotions,
Mm-hmm.
how animals kind of reflect our emotional states as well, and how happy or unhappy they get when we are not in our optimal state of existence.
Yeah. Love for you to come into Dog Moms and talk about the hormones and the spay
I'd
and
love
neuter. I
to.
get
I'd
that
love
question
to, and I'd
all
love
the
to. Absolutely, I'd love to. And Karen Becker and I are just recording a 5 or 6 hour segment on the whole thing, because Karen was actually the early person who started kind of saying, hey, there's something wrong. And then she was really ostracized 10, 15 years ago. And now it's a different time. So we kind of agreed that we were going to record a little segment, and it's actually a lot of fun.
Right.
Except yesterday I couldn't record because we had an energy outage, and so we couldn't record. But we hope to have it done like by maybe September. I'd love to come. I'd love to come. It's actually, you know how you get kind of obsessed about something because you go, wow, you know, there is so much potential in that area, and you witness it and see it, you want to share it. So yeah, definitely.
And
Anytime.
that's how you become an
Just let
expert in
me
it,
know.
when you get obsessed, right? That's when we become an expert. You have to get
Yeah.
obsessed about it if you're going to be
Yeah.
really know it. So that's amazing. And we need it because I get the question all the time, all the time.
Yeah,
We need
it's an
direction.
area that is definitely unexplored and fairly new, but I think it's going to take off fairly quickly because it's so clear and so evident. I think that female hormone replacement in dogs, in my sense, there's a little bit of a more complexity because of the cyclic nature, right, of their hormonal kind of cycle. And even though they suggest that we should just give estrogens, most of the protocols, I think that there should be also about 10% testosterone, and maybe we should
Progesterone
actually just take
probably
them,
too.
and maybe progesterone as well. I'm slightly confused about hormone replacement therapy in female dogs because I don't think it's refined, and I think that there's more studies and more research needed. So we'll just see.
Thank you so
Take care.
much.
Bye bye. Thank you.
Bye.
Bye.